About a year ago, I was working with a 6-year-old boy. He came in with probably ADHD. He had not been assessed yet. Some other behaviors that might resemble tics, like he would make a weird noise in his throat and he would walk on his tiptoes, and some other little behaviors like that. Um, as well as quite a bit of anxiety and unwillingness to try new things because he was anxious about failing or about getting hurt or something like that. And so, over the course of about a year that I worked with this child, we were able to use his strengths like arts and crafts. He really loved arts and crafts to explore his emotions, and we would be able to explore each individual emotion and being able, help him be able to differentiate between those emotions and to name them and to figure out what he's feeling in a moment, and that he can sometimes be feeling multiple things. He could be feeling excited and embarrassed and hungry all at the same time. And so during that year, he was diagnosed with ADHD. He was put on a very low dosage of a certain medication, and that also, in addition to helping with his ADHD symptoms, between that and the treatment, helped a lot with his emotional regulation. His mom reported that he was not having as many outbursts at home, and he was able to use his words to kind of explain how he was feeling, express how he was feeling. We also noticed over the course of that year that behaviors like the throat noise kind of just went away on their own, and that's what happens sometimes with children. Sometimes they do grow out of certain behaviors and it's not an emergency. And so, but going back to this little boy, he, by the time we ended treatment together, he was a lot less anxious too. He was a lot more willing to try new things. Like, he had just started taking piano lessons and was really enjoying that. But if you have similar concerns for your child, for their emotional regulation, for their ability to express emotions and sensations, even weird little behaviors that you're not quite sure if what your child is doing is normal for their age or if it's weird enough that something needs to be done about it, that's where you come to someone like me who's able to figure out what is actually getting in that child's way, what's a symptom that actually needs to be treated versus something they might just grow out of. And sometimes kids do weird things and kids are into weird things. And so don't feel like you're trapped. Don't feel like a diagnosis for your child is a death sentence. There's ways to parse through it and treat the things that need to be treated.